Let's Hello everybody, welcome back to another episode on mental health. And today I have Mimansa Oya. So Mimansa is a clinical psychologist, author, and the head of Fortis Mental Health School. So thank you very much for being here. It's my pleasure to have you. Thank you.
Thank you, Lakshit. It's nice to be here.
My pleasure. Before starting, that would be wonderful if you can give a brief note about yourself and about your work and what you do. That would be wonderful.
I'm a clinical psychologist. I've been practicing for more than 10 years now. And I head the Fortis School Mental Health Program at the Department of Mental Health and Behavioural Sciences, Fortis Healthcare. As a part of my work, I see clients, I do therapy work with adolescent age group, adults, families, couples. And as a part of Fortis School Mental Health Program, we do a lot of programs across schools in terms of building life skills, mental health related awareness programs across India with schools.
Okay, great. And before starting the session, the first question to is how do you define mental health? What do you think is mental health according to you?
So mental health, if we look at the component is that it involves each and every aspect of who we are as an individual, whether it is our emotional well-being, whether it is to do with our physical well-being, whether it is to do with our, because mental health, anything that we do in our lives is actually associated with mental health. So if we are not doing mentally fit, it is going to impact our work performance, it is going to impact our relationships, it is going to impact our decision making, our motivation level, our emotional well-being. So mental health in that sense is very, very integral part of our everyday life, and which is why it is very important that we make mental health a priority for each one of us.
Okay, great. And would you like to can you give a brief note about today's topic and what we're going to speak about and what is all about, as you already have expertise in that subject, so that would be great again.
So as we discussed, we would be talking about adolescent mental health today, and because in today's time, it's very important that we also focus on how to equip children and students, for that matter, on mental well-being. How can they keep themselves, mentally fit, and how can we help them equip with the right life skills which is needed, whether we are as parents or as teachers, educators working in schools. It's very, very important that we also place importance to a child's, a student's mental well-being as well.
Yes, yep, great. uh, when you said we go to schools and speak to students and everything, what is the important part you see? What kind of things do adolescents today and children today go through in their minds? What are they struggling with? And in your part and whatever you have studied, what do you see in there and what they're thinking and how their mental health is going?
So what we need to understand is, in a student's life, there are various vectors. In an adolescent's life, one sees that there is academic pressure, there is peer pressure, there is influence of social media. Then in the ongoing time period, we are also looking at the uncertainty that they are being exposed to at the ongoing time period. Then, of course, if there are any difficulties at the level of family or in terms of their relationships with their peers, these things are certain, aspects that one looks at as significant vectors that can impact them. And as adults around a child's life, I think it's very important that we look at and we go beyond academics as well. We are all aware of the fact that academics and the competitive world that they're in plays a very, very important role, and that continues to be one of the common reasons of why students or adolescent tends to face a lot of pressure. But beyond that as well, I think it's very important that we also look at some of these other vectors in their lives that can actually also cause them emotional disturbances.
Okay. And then what's the what's the very very common problem you see every kind of adult or adolescents have nowadays?
So like I said, these are some of the common vectors in their life that can actually impact them. But one also needs to look at the mental health component. If we talk about mental health, statistically wise, 1 in 5 people across the globe, once in their lifetime, are diagnosed with some form of mental illness or mental health related problem. And 50% of this begins as early as 14 years, which actually goes undiagnosed and untreated. So we are also looking at anxiety and depression as one of the most common mental illnesses, even amongst adolescents. And we need to also address that aspect, that when we recognize that there are certain behavioral changes that your child is showing, and you recognize that there is lack of motivation, lack of interest, they are remaining isolated, their moods are persistently sad, or they are showing a lot of moodiness, there is lack of you know motivation to do anything. These are some of the factors that
So in terms of mental health, what in terms of adolescence, I mean, what would you speak about mental health?
So what we need to understand is that the causes that I mentioned are one of the vectors of a child's or a student's life, which can impact their mental well-being, and can also are some of the common reasons of stress in a student's life or in an adolescent's life. What we also need to understand is the component of mental health. So if we look at the statistics, 1 in 5 people once in a lifetime are diagnosed with some form of mental health related problem. And 50% of them begin as early as 14 years of age,
Okay.
which goes undiagnosed and untreated. So we need to also understand the significance of mental health even in a student's and a child's life, which often goes, unrecognized. Because a lot many times when we see these changes in a in a, in a in an adolescent or in a child for that matter, where we see that their moods are becoming persistently sad, they are becoming irritable, or they are becoming dull, when we recognize that they are having lack of interest and motivation, when we recognize that they are preferring to stay isolated, not engage in interactions with family, with friends, when their school performance, academic performance declines, when they also begin to show changes in their sleep and appetite. These are certain signs that your child may actually be struggling with some form of mental health related problem. Now, as a parent or as a teacher, or any adult in a child's environment, we tend to see some of these behavioral signs as just some as a characteristic that a child is showing, that they're not interested in studies, they're not motivated, and they don't have the will to do any of these things. The fact is, what we need to understand, that this may actually be happening because of some mental health related problem which is beginning.
Okay.
And these are the certain behavioral changes that your child is going to show, a student is going to show, when they are struggling with some form of mental health related problem.
Okay.
So we need to be aware of these signs. And when we see that the child is actually showing these signs, we need to be a little more alarmed about them and look at it in that aspect and seek help for your child.
Okay. So what can a normal parent do? Like how can they help their own children, or what things they should recognize at early on, that so they can help their own children?
When they recognize that there are these signs and symptoms that your child is showing, then what you need to do is first talk to your child, see if there are any stressors in their ongoing time period that may be impacting them. Try and help them understand, how can both of them work together to be able to deal with it. Give them the free space to talk about whatever they're feeling, because it is very important as a parent,
Okay.
we don't jump on to conclusions as to what may be happening and how it may be just lack of their focus and lack of their motivation. But we need to look beyond that, and we need to recognize the aspect that if there is anything which the child is struggling with which is beyond their control. So any of these changes in behavior that the child is showing, they may also be experiencing some anxiety, they may also be sometimes experiencing fear, worry about small things. One has to look at that as a parent. When we provide them that initial support, is the child able to show some changes in wherever the problem is? And if not, then it is important that one reaches out to a mental health expert, because then perhaps the child needs that external help from a mental health expert, where they may be struggling with something which is out of their control. And despite you and your child working at the initial level on the problem, there wasn't much change that one could see. And this is where we need to understand that this is beyond one's control, and it is not particularly about just who the child is, who you are as a parent, but we need to understand this component of mental health, which is also caused because of both biological factors and the psychosocial factors. So biological factors, when I say, it is to do with the hormonal changes, and psychosocial factors are the ones that I already mentioned, which is to do with academic pressure, peer pressure, social media, any kind of conflict in a child's environment, in any relationships. All of these things are psychosocial factors which can add and cause a child emotional and mental distress.
Okay. So, would you like to add some message before ending up this session, or would you like to add any kind of message? That would be wonderful, and you can add something as you wish to.
I think what we need to understand is that mental health is a reality, and we need to give it importance, whether it is young children, whether it is adolescent, teenager, or adults. And we all need to equip ourselves with the signs and symptoms of what can happen, and what we can see or in within us or in people around us when they are struggling with mental health related problem, and break the stigma of whatever stereotypes have been associated with mental health. We all hesitate to go to a mental health expert, but we need to recognize that if we can go to an expert for physical health related problem, like I said, that mental health is associated with each and every aspect of your life. So when you recognize you're struggling with something, you recognize your child is struggling with something, go to an expert, like you go to a physician, go to a mental health expert and seek help. All these treatments that we do are scientific based treatments, whether you go to a psychiatrist or you go to a psychologist. And help seeking needs to be normalized. So there is no harm in seeking help.
Yeah.
What you will get is, of course, solutions to a lot of conflicts and problems that you are struggling with. So it's important that you reach out for help, whether you get on a helpline or you go to a mental health expert.
Sure. Yeah. So again, thank you very much for being here. It's wonderful. I enjoyed this session, and yeah, thank you again. Thank you very much.